How many of you recognize this organ? Up in the corner is the overall structure, and below we're flying through it. And is it a heart? Pancreas? Someone said brain. No, actually, it's an ovary. A cleared mouse ovary, to be exact. It's lit up with fluorescent colors that mark the structure. So in red are the follicles where the eggs are developing. In pink are the vasculature where the blood's flowing. And there's lots of other stuff in there too. You don't need to be an expert to appreciate how beautiful and complex this ovary is. It's really, where all of life, at least human life, begins. And yet, this powerful organ has really been overlooked with respect to women's health. So what I'm here today to talk to you about is reframing women's health through the lens of ovarian function, because I think that ovaries contain the key to longevity. And I would say they're important for men in aging too, so stay tuned. I'm a neuroscientist. I didn't set out to study ovaries. In fact, at the core of what I'm interested in is how the brain talks to the rest of the body, mind-body communication, and how chemical signals, hormones, which are really just words in a conversation that transmit information across your body, how signaling between the brain and the rest of the body changes with age and how that might impact systemic aging. So we're here to talk about longevity. So what is it that we care about with respect to aging? Well, for me, it's that aging is a public health pandemic. So we're at a stage right now where age is the major risk factor for all of these chronic diseases that are listed here: cardiovascular disease, neurodegenerative disease. It's actually your age that's more important than any other risk factor that you might have. And thanks to basic science discoveries, we are now in a position to understand what's driving aging and exploit that knowledge to reduce overall disease risk and tackle all of these age-related diseases at the same time. At least that's the promise. But for me, it's about extending health span, not lifespan. So what we're interested in doing is, we're all familiar with this curve of decline in function over time. We'd like to square this curve off so that we increase the number of years that someone's healthy. And as we're making progress in extending healthy longevity, there's really one organ system that falls off the curve, and that's the female reproductive system. So if we don't address this chasm right here as we move forward, then we're going to make inequalities worse and not better. And this is because soon women will be living more of their lives after menopause than before. And I have them labeled as reproductive organs, but I would beg all of you in the audience, let's stop calling them reproductive organs because they're important for so much more. And I think calling them reproductive organs has really allowed all of women's health to be pigeonholed through the lens of fertility for the last 100 years. And in some ways has made it seem small, like a niche subcategory of medicine, when really what we're talking about is something that impacts half the population. So stop calling them reproductive organs. Now, it is true that women live longer than men by a few years on average, wherever it's been measured. But this neglects the fact that women, if they're lucky enough to live to old age, spend more of their lives in poor health. In a way, you could reframe that and say they have reduced health span compared to men. They're more likely to suffer from things like Alzheimer's disease, osteoporosis, autoimmune disorders. And so women's health span is actually compromised, and that is directly because of aging in the ovaries. So ovaries age at about 2.5 times the rate of the rest of the tissue in a woman's body. And what that means practically is that a woman who's in her late 20s, early 30s is already showing signs, overt signs of aging in her ovaries when the rest of her tissues are functioning at peak performance. This is something that's really important to consider when we talk about healthy aging. Ovaries are endocrine organs. They are producing dozens of these hormones. We often talk about the big three: estrogen, progesterone, testosterone, when we're talking about female reproductive organs. But in fact, they're making dozens of hormones that are talking either directly or indirectly to almost every tissue in a woman's body. And while we really don't understand a lot about these axes of communication, because we literally haven't done the science to understand it, what we do know is what happens when we take ovaries away. And so what we can say about these axes of communication is that they are promoting health. And it's a major misconception to think that ovaries are only important for fertility and menopause. In fact, at any age, if ovaries aren't working properly, that uncovers risk for different health issues. And which health risks it uncovers depends on who you are as an individual and how old you are. And so, for a young woman who hasn't even gone through puberty yet, ovarian dysfunction might mean that there are issues with irregular menstrual cycles or going through puberty to begin with. For a woman in her 20s, ovarian dysfunction might mean increased risk of things like PCOS or POI. For a woman in her 30s, we're all, I think, pretty familiar with the downstream consequences with respect to fertility and miscarriages. When ovarian function starts to fluctuate in a woman's 40s, that uncovers the 135 and counting symptoms associated with perimenopause. And then at and after menopause, ovarian dysfunction can uncover risk for cardiovascular disease, osteoporosis, cognitive decline. There's a whole host of things that happen, but it all comes down to the fact that ovaries are important for health at any age. And in fact, menopause has a really profound effect on a woman's quality of life. And we think about this as an issue truly of equality. The fact that women go through reproductive decline in midlife really it changes every aspect of their adult decision making. So ovaries are the architects of health and the pacemaker for aging in women's bodies. And what this means is that we need to start thinking about them with respect to healthy aging. Humans are weird. We've adopted a reproductive strategy that almost no other species uses. We make all our eggs up front. So the egg that I came from was made in my mother's ovaries inside my grandmother's womb in 1956, even though I was born in the 70s. And, you know, coming back to this, we really don't understand how ovaries work, full stop. The consequences of ovarian aging are profound, but we don't understand why it happens, what's driving it, why it's so different between individuals, and why it happens so early. And quite frankly, until we understand the underlying drivers of ovarian aging, we are not going to be able to tackle healthspan in women. There's a compelling economic argument for studying ovaries as well. The WAM report showed that for every $350 million of money invested in women's health, that translates to a $14 billion gain in the economy. Now, why are we here? Like, why is it that we don't already have the answers to these questions? If testes were aging and stopped working in the middle of a man's life, we would have already figured this out, right? Persistent societal taboos, which I think have been shattered, but also massive underfunding. So this is the US example, but it's true across the world. On the left is public funding, it's paltry, and that drives underfunding on the private side. And so that means less than 4% of private investment have gone towards understanding women's health. This has had profound effects on how we understand female physiology. And as a result, things like drugs that are pulled from the market due to safety concerns are much more likely to be pulled for adverse effects in women than in men. And that is because of systemic sex bias in biomedical research. So the physiology of the female sex has been understudied forever. The male body truly has been biology's baseline. And this is reflected in the US in the fact that it was only in 2016 that the NIH mandated that grantees had to use both males and females in their studies. So you can't really understand what you don't study. Looking at drugs that have been developed over the last 16 years, only, again, less than 4% of drugs that have been developed went towards female-specific concerns if you don't consider cancer. So imagine what we would know if we had spent equal amount of time and money studying female physiology as we have studied male. This is what the pipeline looks like today. I'd like to tell you that it's getting better, but in fact, for all of those conditions that are impacting ovarian aging, we have almost nothing in the pipeline. Less than 2% of the product pipeline is for diseases and conditions that impact female health span. So the pipeline's empty. And A few years ago, we decided that we needed to change this. Actually, around the time that I started to understand how little I knew about my own ovaries, we started a center to study healthy aging in females through the lens of ovarian function with the goal of understanding the drivers and then those underlying causes. As part of that, we started a global consortium 4 years ago. And our goal here is to really accelerate and facilitate the research that's happening and to translate as fast as possible things from the bench to women's hands. And part of this is me talking to you. In building this ecosystem, we want to bring together the creative scientists, the physicians, the people who are going to do the work, but also the funders, the investors, the biotech, the pharma, the governmental officials, the policymakers who are going to actually make this happen. So we're building a network of people, funding research. We've funded 49 scientists all over the world to study ovarian aging. Until the government catches up, we're doing that. And in 4 years, we've had over 50 papers published from the research that we funded. And in total, we put forward $14.5 million. This is all funding that's been raised through philanthropy. And compared to the problem, if you think about how much funding has gone into male erectile dysfunction over the last decade. No, I'm not kidding. And I'm not saying it's not an important problem. It's a very important problem, but it impacts less than 20% of men, and it doesn't have this pleiotropic effect on men's health span and lifespan. Billions of dollars have gone into studying and developing drugs for erectile dysfunction. So $14.5 million is basically a rounding error, and we need to do better, and we're working on it. Just to close, I would say ovarian aging is something that's going to impact every female on the planet who lives past their teens. And, this is something where the health risks get worse with increasing age, and I think it should be exactly the opposite. I think that women should have the agency and the freedom to live healthy lives and to particularly be healthy in those later decades of life when they've got all the wisdom of a hard-won life. So at the end of the day, I think my plea to you is that if you're a researcher, I would love it, and I think you should consider ovarian aging as it relates to your own work, because this is a gap, a data gap that we need to fill. We're decades behind in doing it. We need an army of creative scientists and physicians to fill this pipeline. Beyond that, if you're interested in what I'm saying and you think this is important, then I would encourage you to become an ambassador, to talk about this, to tell other people about it, and to hopefully spread the word so that we can get more and more people interested in this. And then finally, if you are a female powerhouse, if you're one of the people who's publicly said that women's health is an important thing that we need to focus on, I'm thinking of the Melinda Gateses, the Mackenzie Scotts, the Oprah Winfreys. There are so many people like that. Imagine what would happen, how much progress we could make if those stakeholders were actually putting their money behind what they're saying. So I would encourage you to join me. Thank you.